Hi everyone, welcome back to my channel. I am Namna Kharal, and in this video I would like to share some important concept on basics of electrocardiogram, including some important points for atrial fibrillation and ventricular fibrillation. So let's begin with the definition of electrocardiogram or EKG. We know that electrocardiogram is simply the diagnostic test that helps to measure the electrical activity of the heart, which means when the heart is either contracting or relaxing, it generates the electrical impulse. So EKG helps to measure how the electrical activity travels through the heart. So in first picture I had made that's a rough anatomy of the heart. The upper chambers are atrium, which is represented by A, and the lower chambers are ventricles, which are represented by V. And in second picture I have made the PQRST waveform. So to understand about EKG, we have to identify some important concepts or the important terms. The first one is depolarization and the second one is repolarization. So depolarization means it's a contraction. So if you forget what is depolarization, just remember that D comes with C. So C and D comes together, right? So depolarization means contraction and repolarization means relaxation. So both have RE, RE. So it's easy to remember. Now going on to the waveform, PQRST waveform. P is represented by atrial depolarization, which means atrium is contracting. So we know that depolarization means contraction. If you see this rough diagram, first of all, atrium of the heart contract and sends the blood down to the ventricle. So when the atrium is contracting, it forms P wave. QRS complex is formed at EKG when the ventricles are depolarizing, which means contracting. And after the ventricles has received the blood sent by the atrium, the ventricles contract because the ventricle has to pump the blood to the other extremities of the body. So when the ventricle is contracting, it forms QRS complex, that is ventricular depolarization. Similarly, the third one is T wave, which means ventricular repolarization. So after the ventricles contract and pumps the blood to the other extremities of the body, now it's the time for ventricle to relax. So while the ventricle is relaxing, it forms T wave on EKG. So this is just a simple way to remember how PQRST wave forms. Just in case if you get confused between P wave and QRS complex, remember PAD pad, which means P for P wave and A for atrial, D for depolarization. So P wave means atrial contraction. Now the other important concept to remember for NCLEX is the duration of PR interval and the duration of QRS complex. So the PR interval is measured from beginning of P wave to beginning of QRS complex. And the duration is measured in second. So when we see the EKG graph paper, we can see there are large number of big boxes, and in every big boxes there are 5 small boxes. So we can see that one small box is equals to 0.04 second. So 5 small boxes should be 0.04 into 5. So that would be 0.20 second. The duration of PR interval is 0.12 second to 0.20 second. Whereas for QRS complex, the duration would be 0.06 second to 0.12 second. So based on that measurement, we know that PR interval would be 3 to 5 small boxes. Because as you can see, 0.12 second is 3 small boxes and 0.20 second is 5 small boxes. Similarly, for QRS complex, the measurement would be 1.5 box to 3 small box. So in NCLEX, sometimes they might give us the duration of PR interval or the duration of QRS complex, and based on that duration, we might have to identify which rhythm is it. So always remember the duration of PR interval and the duration of QRS complex. Now moving on to the main topic, AFib and BFib. First of all, I'd like to tell that these AFib and BFib, they are not the normal cardiac rhythm. They are cardiac dysrhythmias. They are the abnormal rhythm generating in the heart. So at top, there is normal sinus rhythm where there is a P wave, there is a QRS complex, and there is a T wave. And the distance between R to R is also regular. That means the distance from first R to second R and second R to third R are equal. Now, when we simply talk about atrial fibrillation, what actually happens is, in atrial fibrillation, the atrium of the heart is quivering, which means the atrium of the heart is just shaking, or there's a spasm of the atrium of the heart. It's not squeezing the blood effectively to the ventricles, down to the ventricles. Whereas in ventricular fibrillation, the ventricles are quivering, means the ventricles are shaking. The ventricles are not contracting effectively. When we see the rhythm of atrial fibrillation, we can see that there is a QRS complex in F wave, but there is no P wave before each QRS complex. So there is a QRS complex and there is a R to R interval. But the R to R interval is not regular. They are irregular interval, which means the distance between first R to second R and second R to third R may not be same. From the picture, how we can differentiate normal sinus rhythm with F wave is, in F wave there is no P wave, whereas in normal sinus rhythm we have P wave. In F wave there is R to R interval, but the interval is irregular, whereas in normal sinus rhythm the R to R interval is regular. Now moving on to the definition, in atrial fibrillation there is a rapid, irregular and disorganized impulses that are generated at the atrium of the heart. There is a rapid heart rate of usually 350 to 600 beats per minute. Since the atrium of the heart is not contracting effectively, as I said earlier, the atrium is just quivering or atrium is just shaking. Due to this reason, the blood is pooling at the atrium of the heart, and there is a risk for formation of the clots or the risk for thromboembolism. And to minimize the risk, we provide the anticoagulant drugs. In ventricular fibrillation, the ventricles of the heart are not contracting effectively, so there is a rapid, irregular and uncoordinated rhythm generating at the ventricles of the heart. We can see that the rhythm is very disorganized and it is a kind of wave-like form. And from the rhythm we can see that there is no P wave and there is no definite QRS complex. Ventricular fibrillation is a pulseless rhythm and the patient is unconscious. Since there is no pulse, there is no cardiac output. It's a deadly rhythm. So the immediate action should be to defibrillate the patient or to provide the shock. So always remember that when the patient is on VFib, we have to defib. So in NCLEX, if they give any of this rhythm, we can easily differentiate between AFib and BFib looking at the wave, looking at the P wave, looking at the QRS complex. I hope this video would be helpful for you while preparing for NCLEX, and hope to see you again with some other important NCLEX related videos. So keep supporting and keep subscribing. Thank you.